Welcome, everyone. Thank you for joining us. I am Julie Moose, Executive Director of the National Press Club Journalism Institute, and I am very happy to be here with you and very honored to be here with our two journalists from the New York Times, reporter Sarah Maslin Nir and editor Tim Herrera. So thank you guys for joining us today and for being comfortable talking about your professional and personal experiences with coronavirus. We're going to get to the beginning of that conversation in just a minute, but first I want to let everybody know that we hope you'll ask questions and join in the conversation as well. And so you can go ahead and start queuing up those questions if you'd like in chat or in the Q&A. And we will bring those questions into the conversation, as soon as that makes sense. But first, we're going to go ahead and start with the question for Sarah and Tim. Just if you can, I know you guys thankfully are both healthy now. Tell us a little bit about the process of discovery for you, realizing that you had the symptoms of COVID-19 and what happened after that. Sarah, why don't you go first?
Sure. Actually, my understanding of my illness was deeply linked to journalism. So I have been reporting since March 3rd from the hotspot in New Rochelle, which was the first or second diagnosed case. So the first in New Rochelle, the second in the state. And I've been going back and forth. And what I've been telling people is my understanding of the illness evolved with the country's understanding. So when I first arrived in New Rochelle, I was opening doors with my hand, washing them, but opening doors to that restaurant where I was looking for sources with my hand. By the time I went back, when the emergency order was in place several days later, I was opening them with my elbow. So we were understanding the virus in real time, and I was at this sort of bleeding edge of it. But I came back, and about March 11th, I was having a socially distant snack on my stoop with my neighbor. We were on 2 stoops apart, and she passed me some Clorox wipes. And I thought to myself, wow, unscented Clorox wipes. And then I was like, wait a second, there's no such thing as an unscented bleach wipe. And I remembered a sentence in a story that the Times had done from China about 2 Chinese healthcare workers, one who lived and one who died. And the sentence was, she lost her sense of taste and smell. And remember, this is like March 11th to 17th. That wasn't a widely understood symptom. And actually, I desperately slacked the science desk and said, you have to write about this symptom. They were finding it in Iran, they were finding it in Germany, and then we did, subsequent to my having this. But that's when I realized I was ill, really because of that one sentence in that Times piece.
Yeah, and so for me, I woke up one morning and it was March 11, and I just woke up and I felt like a little tickle in my throat, and I felt kind of like I had some very mild chills, but like Sarah was saying, at that point I wasn't really sure what was a symptom and what was not, and so I thought I'd kind of convinced myself that it was a cold, and I spent that morning convincing myself that it was just totally NBD, that it was just a cold, and I didn't want to have COVID-19. But that morning and that first half of the day, it just kept progressing. And it finally got to the point where I was taking my temperature literally every 20 minutes, and it kept rising. And I finally was like, all right, I just need to get an opinion on this. And so I called my doctor. And the process, as I wrote in the story that came out of this, the process was really just extremely confusing and really difficult to navigate. And that was mostly a result of every institution that I talked to simply didn't know what to do or what to say, because at this point in mid-March, we knew everything was happening, but we didn't really know what to do about it. And so I got bounced around by 5 or 6 different institutions who just said, call this place, they will have answers for you. I call that place, nope, you have to call this place, they'll have answers for you. And I was finally able to get in touch with the hospital system here in New York City, and they're the ones who were the first institution that kind of told me yes, it sounds like you probably have it. This is what you need to do. And then a little bit later, I was able to talk to the CDC, and they kind of echoed that. And then later on, hours down the line, I got a call back from the hospital system, and they said, hey, we'd like you to come in for a test. But it's funny, like after the story published a couple days later, Sarah was like literally slacking me, talking about the story, like asking about symptoms, and she was like, hey, like I like feel like I've lost my sense of taste and sense of smell. And this was, this was a couple days after the story published, and I like literally didn't even know those were symptoms. So I was like, oh, that's so weird. I haven't heard about that. Like, I have no idea what to tell you. That's something I haven't heard about. So like it was just so confusing in that time, and like it remains confusing now. Like I'm sure Sarah has had this experience too, but I've like written stories that were accurate and true one week, but like were outdated in less than a week, just because things are evolving so rapidly. And it's it's really frustrating to like navigate covering all of this, because what is true one day is not necessarily true the next.
That's such an interesting point. And I don't know if you guys saw, one of the things the LA Times did, Deborah Netburn, who's one of the science reporters and a feature writer, actually included a caveat at the top of one of her stories, and then continued to do that, essentially reminding people that this is the best information we have right now, and stories you read tomorrow, next week, next month may contradict this.
So I have a real issue with that, because the idea that this is the novel coronavirus, right? Novel means new. It is novel for America, but other countries have been going through this a month before, China months before. The idea that these new symptoms are rising, like Kawasaki disease, COVID toes you've heard of. The idea that other countries haven't seen this, that there weren't 15 children in China that had this, that China couldn't have called us and said, hey, you're not gonna need just ventilators, you're gonna need dialysis machines as well, because it attacks other systems. It is totally false. And my journalistic questions are, that I've been pushing my colleagues and myself to look into, is, was this us not listening to the other country's experience as journalists, or was it them not sharing? And so there's some sort of information transmission breakdown that's happened, because it shouldn't be news in LA that COVID toes are a thing, when hundreds of thousands of Italians probably had COVID toes. And I was sitting in my bathtub because I had the chills when I was sick, and I realized I couldn't feel the temperature of the water. I had no ability to feel temperature. And now they realize that's because it attacks the nervous system, and that's a sort of frostbite. Turns out Italians were experiencing it, but calling it by this scientific Italian term. Where did journalists or officials break down the information network that is making us reinvent the wheel every place this hits?
That's such an interesting and important question. I'm curious what answers you are finding or will find. And it also kind of goes to one of the things that you've both now mentioned, and that is the way that this experience has affected your journalism, the journalism you're pitching, the journalism you're reporting, the journalism that you're editing. And Tim, you wrote yesterday about your about donating convalescent plasma. And yesterday you, of course, I believe, were scheduled to donate plasma. Can you guys talk a little bit about how the experience that you have and the journalism are sort of informing each other?
Yeah, so it's been interesting being on Smarter Living at this time, because Smarter Living for the 4 years since we launched it was kind of served as kind of one of the homes for service journalism at the Times, but now every single desk is like going ham on service journalism, and it's like wonderful to see. But like really, I think there's no story in the world that isn't directly impacted and changed by coronavirus. And, I think kind of the result of what we're seeing through the spread of this through journalism is just that we know that readers are just as confused as everybody else in the world, and they really need someone to give them answers. And, for me, it's been so wonderful to see so many outlets, and especially the Times, just go full in on providing those answers and doing all that service journalism. And, for Smarter Living, that's essentially all that I've been writing. That's essentially all we've been publishing. But, every desk in the newsroom is just going so hard on it. And, I think it's great. But it's just been really taking a step back from the virus itself, for the industry, I think it's been very, there's just so many changes, and there's so many, things and ways that we're doing things that are just so different from what we used to do. But, and as for, someone who like had it and thankfully recovered, like that absolutely informs all of my writing and the things that I'm doing and the way that I've been editing. Because, it is still, as widespread as it is, relatively speaking to the population, there are still few people who had it and recovered. And so, I think that really does kind of shape your perspective on it. And I think knowing people who have been severely ill with it shapes your perspective on it. And it really just kind of informs the way that you go about covering these things and what I think needs to be written. Like, almost, well, not a good number of the stories that I've written in the last couple months directly relate to my experience. Like I wrote about donating convalescent plasma, and I wrote about like ways for people who are recovered can help and things like that. And, that's a perspective that like is still relatively rare. And so, it's a really good opportunity for me personally and for people who are recovered to like share that information for people who have those questions, because there really still simply aren't that many people who have answers to those questions.
Well, I am living what a lot of our readers are living. And I would like to share one thing. I got a pandemic puppy, which we've written about all the shelters being out of dogs. And I found a hack. I figured out how to get a shelter dog, but he's teething, so please ignore him. Living the experience is the key, right? And that's why shoe leather is super important. And this is sort of the ultimate shoe leather. And I'll bring up an example. When I was covering Hurricane Sandy, I was covering it from Rockaways. And the Rockaways were destroyed. I mean, next level. It looked like a third world country. People were, being on the ground in the Rockaways was shocking. And I was driving back to the headquarters the evening, and they said, oh, we'll go out tomorrow, again. I said, yeah, sure. I just don't know how I'll get gas. And my editor said, go to a gas station. And I was like, and then I realized they didn't know that gas stations were out of gas and that there were 100-car lines for gas stations. And I thought, they're not living this moment, and the reporters are. And it is so essential to live the wave, if they can still hear me. You can still hear me? Okay, sorry. So it's so essential to live the moment. That said, we also have to recognize that Tim and my experience as gainfully employed, middle-class Americans is not the lived experience of coronavirus. Black and brown people in New York City are dying at twice the rate of white people. We're able to sequester in our homes and be relatively, New York hunkered in their homes. That's not true. That's my New York that's hunkered in our homes. So I rewrote it with most of New York hunkered in their homes, and much of New York forced to go outside to work for the people hunkered in their homes. So it is important to recognize that, yes, we're living this experience, so we're able to report on it, but also in many ways we are not living the true spectrum of the experience of coronavirus. So to recognize that limitation as reporters.
Mm-hmm. Yeah, that's huge, because it's, I think, sort of an added layer of challenge right now. If you have not cultivated a culture of inclusion and diversity in your newsroom or in your sourcing, to make sure that your reporting reflects not just your own experience or your friends or family's experience or your editor's experience, but actually, as you said, the lived experience of people who have faced very, very different obstacles. So I'm curious also, Tim, oh, go ahead.
You're not going to have economic diversity in a newsroom where everybody is employed, and compensated for working at this place. You're not going to have the kind of desperate situations. Well, we haven't yet had any layoffs. There's a limitation to your own lived experience here. And this, where we're trapped in our apartments, I mean, I can't go out and pound the pavement and get fresh sources. People are scared to talk to me, and that we have to recognize that or we do a huge disservice to our calling.
Mhm. Tim, how do you think about that also as an editor, as somebody who is charged not only with your own stories, but with, with a section of stories that are intended to serve a wide community?
Yeah, no, it's super, super important and something that we like really have like been thinking just every story that we have. That's like an angle that we're trying to think about and a perspective we try to think about. And it does, it has changed the way that we write and edit stories, and it has changed the type of thing that we're looking for. And it's to Sarah's point, like it is so crucial that we make sure that we cover that type of perspective, because we are living like very different lived experiences from so much of the country. And so for me, I primarily work with freelancers, and so they have been so crucial in bringing that perspective, because they for most of them really are living that experience. And so for me, like my reporting and my writing is informed by my having had COVID-19 and my recovery. But for them, their writing and reporting and the way they're framing stories is informed by being a person with a very precarious job situation. So many of my freelancers like have taken the stimulus checks and like need them to survive. And I'm very grateful for them offering to share that perspective, because that's simply not a perspective that I have, because I am very thankfully employed still. And so having that perspective has been so important. And I think the work that freelancers in general are doing right now is so crucial, because they do have that perspective that a newsroom employee like simply can't really wrap their heads around.
Mm-hmm.
And to one other point, I brought this up on a Metro conference call we had with the whole team. I said, we have to be wary of a new type of access journalism, which is because we can physically access people. Right? Access journalism used to be politicians who want to keep cozy with you. But literally, if we don't have people walking the streets of the Bronx, or up and down the stairs of a NYCHA project because it's not safe, there's a new type of access journalism that's very dangerous. But what is interesting about Tim and my situation, and what I brought up was, if the science is true that now people who have experienced the illness maybe are less likely to get it, a level of immunity, though it's not true, maybe we're the ranks of people who can go out and get those stories. And I've actually put my hand up and said, put me in the hospital. I'll string for someone who's doing a story on hospitals, and the response was, the science not there yet, Sarah, thanks for the sentiment. But but to me, it's really important that we get into those places and don't overlook them.
Mm-hmm. So that brings up a kind of a related question, which is, you both chose to publicly talk about your experiences on Twitter, answering questions for other people who had symptoms, in the New York Times, on the website, on reliable sources, and in other places. Other journalists almost certainly are not necessarily coming forward. There are no doubt many journalists who have either presumptively been positive or tested positive for it, who may not have come forward for a variety of reasons. I'm curious about your thinking in terms of deciding to share your diagnosis and also your experiences. Was that a conversation with editors? Was that something that evolved, or was it just something that you kind of immediately felt like, I know I want to do this, and the relative risk to me of revealing this is low?
Yeah. So, go ahead.
No. So you go first.
So for my experience, I contracted it relatively early on, mid-March. And so, that was a time when there was just utter confusion, and my experience really demonstrated the level of confusion. And so that day, as I was going through this process, I literally was thinking in the back of my mind, this is crazy, and people don't fully understand how crazy it is. And we really kind of need to let people know. And so I was, I was, as it became clear that this was going to be the way the process was going to go, I was thinking in the back of my head, remember this fact, take a note here, remember that quote, just because I kind of knew this was going to turn into a story. And then I reach out to the editor of Metro and was like, hey, I just spent 5 hours on the phone and I have a test tomorrow. Should we write about this? And, and he was very, I'm sure this has been Sarah's experience too, but the Times has been incredibly supportive and helpful in this whole process. And so, I essentially pitched him to like reveal my like medical condition. And, even in that, like, that anybody would understand that that's like a good story. But he was very, very supportive and very clear in saying like, you absolutely are not obligated to do this. Like, do not do this if you feel the slightest bit uncomfortable. Like, there is no pressure whatsoever, which like I felt very comforted by. And it was like really, really comforting for me to know that like an editor had my back in that way. And so that was really, really comforting. And then it was also, it was really funny after the story started coming together, how we were going to kind of like present it. And like, there was just one of those like funny little moments that kind of like bring you a little bit of joy during these times. But when that editor was pitching the story in the big morning meeting where all the top editors go and talk about their stories, he was very careful not to reveal that it was me because he didn't ask my permission. And so like, one, that was like very, kind and supportive. But so he was talking about the story, pitching the idea, telling some of the details that I had in the story. And, again, being very clear not to mention that it was me and nobody asked. But then as a matter of logistics, someone who was kind of taking notes asked, what was the slug of the story? what was the story's ID name in our content management system? And the the story ID for that was the date dash coronavirus Tim Herrera. And it was just like, oh, okay, I'm glad that that's just out there. And like, obviously I was like perfectly fine with that. But it was just, it was a really just kind of like nice moment, but it was also like, showed like it is really tricky when people are like talking about their medical history and their medical experiences, because the level of comfort really does vary. And like, even once someone, agrees to like write about their medical history, there are many things like that kind of cascade down from that they may not be comfortable with. But so for me, like I've been like extremely open about it. And this is the last thing I'll say on this. There was like I had like when I published the story, I got a lot of engagement about it on Twitter. But the trolls came out, of course, as they always do. But there was like kind of a funny interaction I had where one of the trolls was saying that I had violated HIPAA laws because I tweeted a screenshot of my results. And like, come on, like, give me a break. These are my results that I willingly, like, I put these in the New York Times. Like, I think I'm okay with this information being public. But it's just been like, it's just raised some like very weird and sometimes comical issues around that kind of thing.
So, without giving away my next story to 44 reporters who are listening and going to scoop me, I am working on something about the recovered and the stigma and the revelations and stuff, and it wasn't something I thought about. I tweeted when I got my results because I literally went and got tested at the drive-through testing center that I had just gone through for my piece on the Daily, and I filmed it as it was happening, and I think that's a way to distance yourself from the experience, right? I'm not part of a pandemic, I'm reporting on a pandemic. And so for me, it was emotionally helpful because look, at the end of the day, my experience of this was of a tremendously bad and lasting flu. I haven't been scared of the last time I had a tremendously bad flu of a long duration, but because you're part of a larger narrative of death and destruction, it's very frightening. So it was a coping mechanism for me. But I tweeted, well, sometimes you report the story, sometimes you are the story. And I felt almost journalistically obligated because I had become the story to use myself as a reporting tool. I also felt compelled to help others because the biggest thing about coronavirus, especially in the early days of it, which we sort of still are in, is uncertainty. And actually, I'm going to share to the chat. I made a document. Oh, it says to all panelists. Let me share it to all panels. And I made a document called How to Coronavirus. And it's a best practices that I sent around the newsroom. I sent around to anybody who wanted it. Many thousands of people have shared it and read it. It's like, what are you doing to get coronavirus? Well, you have to tell your building, because you don't want the staff in your building to be touching your trash and them to get sick. You can't go to the laundry room. What tools should you have on hand? My colleague, Eliza Shapiro, said Pedialyte and Vicks Vapor Rub really helped her. I didn't have respiratory symptoms, so I included that. Things like a pulse oximeter, which tests the level of oxygen in your blood. They're $30. When you go to the hospitals, especially during the height of this, they would test your blood oxygen and send you back because it wasn't low enough, even if you were having trouble breathing. So a pulse oximeter, if you have one on hand, saves you that very frightening, exhausting trip to the hospital that they're just going to send you back. So I learned all these best practices, and I felt, if you are the story, it's your obligation to report on it. Journalistic mores have really shifted. Our little faces are at the top of all of our bylines now on the internet, but maybe it was the perfect time for this crisis that hit us personally to shift along with those mores. My last thing is that I did a story last week on therapists in New York dealing with coronavirus, and a therapist said to me, never have I ever underwent a trauma alongside my patients. I'm used to being a vessel for trauma, but now we're both in the trauma. And that's all of us, right? This story is, we are its sources and its chroniclers.
So related to the story about therapists, you also reflected through them a spirit of resilience. They talked about some of what's helping them and some of what's helping other people. And in preparing for this, one of the things I discovered was that you, Sarah, had in fact been pitching the New York Times many times persistently before you actually became first, I think, freelance writer for them, and then full-time, and then also pitched your Pulitzer Prize finalist investigation on the nail salons 4 years before you eventually did it. So I'm curious, both for you, Sarah, and for you, Tim, there are a lot of young journalists who are just about to graduate and enter journalism. So I wonder what you hope they will take away about persistence and the value of journalism right now.
The question for me?
For you first, and then for Tim also.
Well, I'm going to answer it in two tracks. If we're talking about resilience, as you began your question, resilience in the face of this disease, I think that the ability to be resilient right now is a privilege. Many people are not resilient in the face of this disease, they're dead. And we have to remember that our resiliency is a privilege, and we have to use it for the common good. That's the first angle of resiliency in the face of disease. And then in the other, my dad was a Holocaust survivor with a 5th grade education because the war broke out and he went into hiding. And he ended up getting a high school equivalency and becoming a doctor who was an esteemed doctor who lived in Manhattan for the rest of his life. And my dad always had a motto, which I invite everybody, get out your pen. Let them say no first. So it's let them say no first before I tell myself no. And so many times I hear young people, well, the Times would never accept my idea. Well, it might not work. Let them say no. Don't do the work of saying no for other people. And so that's been my motto. I mean, I busted down every door to sit at the Times, to get in the Times. And finally, when I was freelancing for them for a ton of sections and stuff, they said, would you like to do a maternity cover for 6 months? This is how I got my start. And I said, sure, I just have one condition. And they were like, I'm sorry, you have a condition for the New York Times? And I was like, yeah. I need a metal nameplate, one of those engraved plates that everybody has at their desk. I want it at my desk for the 6 months. They gave me a nameplate. Everybody thought I worked there, and I have ever since.
Wow.
Yeah, I didn't know. That's great. I think this just this terrible situation that we're all in has, decimated the industry. And, we all, I'm sure, personally know friends who worked at outlets who have been laid off or furloughed or had salaries cut, or freelancers who have lost work. And like, it sucks. Like, it's really, really difficult. But, I think there is still, for people who are in that position, I think it's just kind of important to remember that there are still some opportunities out there if you kind of seek them out. So I've been for the last couple of weeks doing these, and I encourage everyone to sign up if they're interested, doing these free freelancing panels and workshops where I invite a few editors on. We do a Zoom for an hour and a half and just kind of talk about freelancing and talk about how to pitch your stories. If you're interested, go to my Twitter, there's information there. But what has kind of emerged from that is that there are so many editors and people who are employed and who are in situations that are a little less precarious, who are willing to help. And, I think, the one thing that I would encourage is for people to like reach out to people and ask for help. Because, I think that we all are feeling like extremely helpless right now, because like the best thing that we can do for other people is to stay at home. And so I think a kind of a weird but very nice benefit from that is that people have been extremely generous with their time and expertise when they have it. And I think people really are extremely willing to help. And so I think, any, people who are having like a rough situation right now, I think it's a really good time to like reach out and like ask for help, because you will be like shocked. Like, I've been just like dumbfounded at the number of gainfully employed editors and writers and reporters who have like reached out to me unprompted saying that they want to help with this project that I'm doing. And it's just like so heartening to see that. And so, there is, things are terrible, but there is some level of help out there. And really you just kind of, you have to like go out and ask for it.
Thank you both so much. I know there was so much that is going to stay with the participants and with anybody who watches this afterwards on video. And we will share out the links that you guys have talked about, including the document that Sarah shared and the Tim's Twitter feed, so that folks who want to can take advantage of those resources too. And we also encourage you to go to pressclubinstitute.org, where you can sign up for Covering Coronavirus newsletter. You can see more upcoming programs like this one and register for those if you're interested. And also see a feature on the class of 2020, who we are profiling regularly, so that they can connect with hopefully future colleagues and with others who are willing to mentor and support them. So thank you guys so much again for doing this, and thank you all for being here, and stay well.
Thanks, take care.
Thank you so much. Thank you so much.